Doctor, I would appreciate very much if you could give us an overview, definition of what is menopause.
Well, it isn't highly specified as much as we'd like to think it is. It's really a spectrum of changes that take place in a woman over the course of her whole life. I mean, it relates primarily to hormonal issues and the fallout from changing hormones. And so menopause, when in the heck does it begin? I mean, really, a woman is at her absolute peak ovarian hormone production in her late teens or early 20s. And then that production starts to diminish over time. And one could say, technically, that part of menopause is the decline of the ovarian hormones. But usually women don't feel those initial stages, so no one in this field is going to call menopause starting at the age of 23. But it's a spectrum. That decline is very gradual. And then as the decline reaches a certain threshold, the effect of having low hormones is felt by the woman, either in a subtle way or a more dramatic way. And then if you go a little further down, if the hormones get low enough, the woman stops menstruating. And that's officially when we start looking at the beginning of menopause, but gynecologists rightfully don't declare menopause until there hasn't been a period for a year. So that's the official definition. So that's when we can officially declare if a woman has not had a period for 1 year. But you can see really it's a spectrum that's occurring because of hormonal decline, and you know it keeps on happening. That period stopping is just a road stop along the way. The hormones continue to decline after that, and elderly women have very severe declines and very consequential declines. And one of the most rewarding parts of my practice with elderly women is restoring hormones in them, because it can make a major difference on muscle strength. And if they don't have muscle strength, they fall and fracture their osteoporotic bones, and they can't keep their balance. There's wives, they get up at night to urinate. They have cognitive dysfunction. It's very distressing to them and their family. So we're also treating menopause in the 80s and even 90s.
Is the average general practitioner on a regular basis looking out for those things that might be indications, or how do we know and understand that the average doctor is looking for those symptoms and can be able then at that point to help you find what you need or be able to supply that themselves?
Well, that is a public health important question, because the loss of hormones is so significant to men and women. I mean, we're talking to Scott about the energy, and that in itself is so relevant to health, losing energy because of lost hormones. And I think you bring up a very important point, that in the world of medicine, my goodness, there are so many good people at all levels of it, doing beautiful work. And the field is so huge that the average, I don't know what's actually true about this, but doctors are seeing a lot of patients, and they're dealing with a lot of different issues. And then the question becomes, how knowledgeable are they about menopause and andropause? Because if they're not knowledgeable, the best thing they could be able to do is recognize it and say, listen, I have a friend in this town that is really skilled in hormones, menopause and andropause. Let me send you to them for that. That could be one of the best things that could happen for someone who just doesn't have the time and energy to take on the specialty that this is. Because treating women and men in menopause and andropause can be done in a simple fashion, but often it leads to mediocre outcome, and sometimes there's risks involved, and it leads to not good outcome. It's become a much more extensive knowledge base that's required to practice it really well and help reduce risk to near zero. So with all wonderfully huge respect to all earnest and skilled practitioners, and there's so many of them, they have to take an interest in going, gosh, how can I help my patients look at this thing that's happening? There's this menopause and andropause. I'm going to go out and learn about it.